Can you hear me? Hello. Okay, great. Hello, everyone. Thank you for joining us today. We're here to celebrate an extraordinary story of resilience, determination, and exceptional care. Today is all about Rudy, his recovery, his strength, and the remarkable team that stood beside him every step of the way. Rudy came to University of Utah Health on September 9th, 2023, with life-threatening injuries. At that time, the road ahead was pretty uncertain, but through careful planning, expert care, and Rudy's own perseverance, today he is back doing what he loves, running his company, spending time outdoors, and enjoying life with his family and grandchildren. Many of our patients here become like family. And Rudy's connection with his care team is a perfect example of that. We are incredibly proud of his progress and deeply honored to have been part of his journey. Today, we're going to walk you through Rudy's path to recovery with a timeline that highlights key moments in his care. He is joined here by some of his incredible providers who helped make this recovery possible. With otolaryngology, head and neck surgery, Doctors Hillary McCrary and Richard Cannon. Dr. David Adams is with oral and maxillofacial surgery. Dr. Rhett Tucker is maxillofacial prosthodontry. Sorry if I get this wrong, big words. And Paul Tanner with facial plastics. So, of course, this journey involved many hands and hearts. To all the member of Rudy's care teams, thank you. Each of you played a vital role and your dedication is truly appreciated. Now we're going to start from the very beginning with Rudy. We want you to take us back to the bear attack.
September 8th, 2023. Is it working or let's get a little closer? September 8th, 2023, I'd received a call the day before from a father and son that I had rented side by sides to for opening week of bow season. They had wounded a deer the day before and lost track of it because there wasn't any snow. I used to be a guide in my young days. I claimed to be a fairly decent tracker. I was in my young days anyway. But I volunteered to come up and help them try and locate the wounded deer the next day. They were camped up on the mountain, so we didn't meet right off the bat, go up there together. I just drove the 4-wheeler up the trail till I ran to the machine. I rented them and I texted him and said, well, I'm at the machine. And he sent me a pin drop and I not very tech savvy. Gray hair kind of fades out. I'm in that generation. But he sent me a pin drop, and I knew it was north of this trail and west of that trail. So I started hiking down the trail. I get a text from him, and he's like, well, it's better to go down the ridge instead of down the trail because then you don't have to mess with the cliff. It's like, crap, I'm already past the cliff. So I shot up through the trees, think we'll all come up the other side of the cliff. And I might have to take my John Stockton jersey off. I don't want to get it all drooled up. But I got probably 500 feet into the trees and jumped the first bear. It was probably his first year out on its own. It took off like a shot. I barely saw him. But from that moment on, I pulled my gun out and had my gun in my hand. My first bear encounter was when I was 10. I've had a lot between that one and this one. So I know bear tactics, bear savvy, and generally what bears do and what you want to do and don't do around bears. I know signs of, whether a bear's going to be aggressive or not. And usually you get those warnings from them. I met up with the father and son after the first bear. And I had a little time between the first bear and meeting up with them. And I finally got to the pin drop where they left their backpacks. I texted the father and I said, you know, I'm at the backpacks. He's like, wait right there. We're only 5 minutes away. I'll send my son back to get you. I figured, well, I got a little time. I had a drink of Gatorade, had some jerky. I thought to myself, I need to spin that revolver because I always keep a dead shell in the cylinder that's going to fire next in case my kids or grandkids ever got a hold of my gun. And I spun it, and one of the reasons I know that this was meant to happen was I spun it right back at it and shell. But we met up with George and his son, and we could see crows circling in the sky, and we figured that's where the deer was. So we kind of split up a little bit so he could come in more country, but we could still see each other. Started heading down the hill because we couldn't see where the crows were landing. And we got a ways down the hill, and I stepped over a log, looked over to see where George was. Another bear was coming at me, and he was as close as you guys are. I remember him, he was like this, coming at me. And I raised my gun because I already had it in my hand and fired that shot, and it was fine. And I'm sure I rolled my eyes and said a few choice words. I don't know if I had time to, but I remember my nose or my fist was about the same size as his nose. And that was always one of my bear tactics, was if I ever had to confront a bear, then I was going to try and hit him in the nose, because if you hit a dog in the nose, it kind of waters their eyes and at least might stop them or hesitate for a second. And I don't remember him biting my arm, but I got a tooth hole there and a tooth hole there. But the next thing I remember is he had me by the jaw. And I think he picked me up off the ground, and I believe he picked me up off the ground because I could see the father running towards me while he had me by the jaw. And I remember being in a Christ-like position. I said, help me. And then he clamped down. And I could feel and hear my jaw break. I don't remember any sound. You know, I don't remember George yelling. I don't remember him shooting his gun. I don't remember the bear growling. I don't remember hearing the bear running at me. I just remember hearing the crunch. And I'm assuming I fell to the ground. And that's when he stepped and raped my chest and bit my leg. I knew I was bleeding out of my leg more than I was my chin, while I was waiting for rescue to get to me. But that was the attack. And it was probably, I tell people, it was all the unforeseens or all the wrong circumstances at all the right time that both bears reacted the way they did, because I guarantee it, the little bear was eating on the big bear's food every time he was drawn away from it. And the big bear was used to chasing the little bear away. So they both reacted the way they did. And the fish and game stopped looking for the bear the next day because he was guarding a carcass and a stash of pine nuts. So they deemed that he was acting appropriately, that he wasn't just an aggressive bear coming after people. You want me to keep going? Took him 2 hours to get to me. I was conscious the whole time. The only parts I don't remember is the leg, and after he broke my jaw, I'm pretty sure that was just brain influence saying, shut down. You don't want to see this. You don't want to hear this. You don't want to know this. But according to the father, one of the reasons he didn't use the gun that he had was because the bear was shaking me around like a rag doll. And he didn't want to hit me. But I told people that I was glad that I was there, that I'm glad that it happened to me. Because if I hadn't been there, the father would have been the closest to the bear and he would have attacked the father. And I just don't know that the son would have been enough to chase the bear away. I've had people whine and tell me, well, you should have used bear spray. You should have bear spray ready. I did have bear spray. I had it right from my gun holster. And if I hadn't had my gun in my hand, I wouldn't even have got it up to get a shot. I probably would have got it out of my holster and he would have been on me. That's how quick it happened. And generally, bears, like I said, will give you signs whether they're going to attack you or not if you've got distance between you. And that's one of the things that, a bear will attack you if it's a mom protecting her cubs, if it's any bear protecting a food source, or if you startle them and you surprise them and they don't know what's going on, so they just react aggressively. Those are the main reasons a bear will attack you. When this one had two of those three factors, it wasn't a mom and a cub, but he was guarding a food source, and I guarantee it, he didn't know I was right there until I was right there. So it was a surprise to both of us. I'm sure he might have said, "Oh shit," too.
Thank you for sharing your story, Rudy. So Rudy came to University of Utah Health, like I said, on September 9th. He was flown to us from Bozeman, and Dr. Hillary McCrary is going to walk us through his injuries.
Yeah, so backs up a little bit. You went to the hospital in Bozeman, and it was a Friday night. And my co-resident, who the exact same year in training, who lives in Bozeman and is a general ENT up there, she called me and told me what had happened, that she just got a consult for a patient that had been attacked by a bear, and she was going in to do a surgical airway and sending him to Salt Lake City, which seemed like the proper thing to do. So by the time they made it to Salt Lake, he already had a surgical airway, so tracheostomy tube or breathing tube in the neck. And this is pretty much what Rudy looked like when I met him. I had a little bit of imaging that kind of demonstrated the extent of the bone that was missing in the jaw. And I had basically a very good idea from the get-go what needed to happen. And I remember meeting his sister and Rudy that morning, and I basically said that we are going to be able to fix this, and that we need a little bit of time to do some surgical planning, but that we'd be able to reconstruct his jawbone using a leg bone, his fibula bone. And this is something that we actually do all the time, just in a little bit of a different setting, normally for patients that are suffering from cancer, that have a cancer that's invading their jawbone. And so basically from that moment, we kind of started with the surgical planning process. We would get more CT scans and more information. And I will say the minute I met Rudy, it was very obvious that he was so willing to kind of do whatever it takes to get through this, and had such a positive attitude. And I will say that I would find it hard for me to do that, to be so positive about something right after something so life-threatening and scary had happened. And so it was immediately obvious that Rudy was an exceptional patient, which made me even more excited to take care of him. So, yeah.
Rudy, what do you remember when you were conscious and woke up at the hospital? What do you remember seeing or feeling?
If I remember right, I was kind of strapped into a upright bed that wasn't straight up and down, but it was kind of, so I wasn't, choking or whatever. I remember kind of being in a fixed position and locked, so I couldn't scratch or pull tubes or wires or anything out of me. I couldn't talk, So they gave me a whiteboard so I could communicate with the whiteboard. And I remember one of the nurses came in and had a little swab on a stick, a little sponge on a stick. She's like, "You want me to swab your tongue?" And I don't know about you, but have you ever had your tongue that dry? But my tongue was like sandpaper at that point because my mouth was open for more than 24 hours constantly. And it was like heaven to me. And so that was, she couldn't get it wet enough so I could swallow because I would swallow stuff down into my lungs and get pneumonia or whatever. So they wanted me to swallow, and I just couldn't comprehend. It's like, well, I'm swallowing spit constantly, and you told me to practice swallowing so I can build those muscles, but I can't swallow lemonade or root beer or something good. They explained it all to me that saliva can go into the lungs and it will absorb into the lungs, but anything else won't. And you'll reject it, and that's why anytime you swallow down the wrong throat, you're coughing it up and trying to get it out because your body knows it doesn't want it in there.
Yeah, so a few days after he initially presented, so this image that you're seeing is what we call 3D reconstruction of his face and all the bones in the face, the jaw, and you can see that his jawbone, lower jawbone, was missing a pretty substantial portion of the bone. Um, but he also had other injuries. He had fractures to his larynx, and without any stabilization of those, this could cause issues with swallowing, speech. And so we took him to the operating room a few days after he presented on September 12th. And at that time, we kind of cleaned everything out, got everything nice and healthy, and we put something called an external fixator on the jaw to kind of keep things from contracting down and help improve our outcome of our reconstruction. And then we also plated several fractures in his larynx area. It was a pretty uneventful surgery. The general surgeons also put in a feeding tube because we knew that he would not be able to kind of eat normally for some time. And so that was kind of the initial stabilization surgery that we did.
I told them when they had that external fixator that I needed a little plastic cap so I could feel like I was playing football again. Because that's what it felt like. I had the football thing on the front when I needed a plastic part on the helmet.
Yeah, so kind of over the course of the next couple weeks, we were able to do some virtual surgical planning. And this is Rudy's exact surgical plans that we have up. As you can see here, we were planning on using the fibula bone, which is kind of the best workhorse free flap that we have for bony reconstruction in the head and neck. And you're actually able to take about 20 centimeters or more of the fibula bone. And it's not very consequential to the patient in terms of long-term walking outcomes, things like that. And so we have decided to use his left leg, and you can kind of see the pink area there is the bone that we were going to freshen up the edges to get to healthy, nice bleeding bone. And then this is kind of the last segment is the 3 segments of fibula that were used to kind of reconstruct his jaw. And so we met virtually with some engineers and one of our plating companies. And we were able to kind of make everything customized just for Rudy to make sure he had the kind of best surgical outcome. I think, yeah.
Yeah, so we call this VSP or virtual surgical planning, and we had done it rarely at our institution prior to Rudy, but never really exactly like this with simultaneous dental implantation and really a surgery this large. And so it's really cool at this point, kind of almost 2 years later now, looking back, on what we've done since then. We've really kind of taken this situation with Rudy and and really been able to kind of build this team. And now we've probably done 30 or 40 kind of similar cases like this since. We do maybe one every week or two. And, Rudy, in a lot of ways, was kind of the pioneer for this new technique, coming to our institution. And so it's really amazing to look back and kind of think of it like that. And I've got to give a lot of credit to Dr. McCrary. She, I think, early on recognized, the severity of the situation, but then also Rudy's, fighting spirit and how courageous he was. And so she really pulled out kind of all the stops to kind of put all this together, build this team, and really try to push the forefront forward to do the best reconstruction possible so that we could recreate form and function as best as possible for Rudy. And so now it's become kind of a streamlined process for us. We meet, I'd say, like I said, every week or two together. And it's really cool, the team that we've built, every part of it, even though we're kind of siloed and we all do our own things, each step kind of builds on the step before. So just like you see, we decide first, what are we removing as far as freshening up the edges, getting a good building block to build the reconstruction on. That's the start of the surgery. The second part, the fibula bone, bringing the reconstruction up from the leg is kind of like a transplant to yourself. We bring an artery and a vein and hook it up, and then it has its own blood supply. And then, we have to put a plate with, plate and screws to kind of hold everything into place while it's healing. And then the last step is once that's all, kind of built up, then you can put the implants in to figure out, where the teeth will be. And like I said, each step kind of builds on the other. So through the process and multiple iterations, like we've really honed how we do it and gotten better and better. And Rudy was really the catalyst for all of that, which is amazing.
Rudy, what were your thoughts when you learned about the complexity of your surgery and what they were going to do?
I knew we had spare parts. I thought it was amazing that, they could even do something like that. I remember waiting for the helicopter to get to me, and the only way I was comfortable was on my stomach with my arms underneath me. And I knew my jaw was gone because I could see the flaps of skin hanging down and the blood dripping from it. So I knew there wasn't much there to work with. And I just think they did an amazing job. And I know it wasn't easy. It wasn't like a cancer surgery where they could plan where they're going to cut. It's all nice and smooth and easy going. But it's like, my jaw on this side is crooked enough because I got a tooth there and a tooth there, and the rest is gone. But this one's crooked, so the back of it hits the front of the tooth on top, so it's not really easy to still chew on that side. So I'm sure it wasn't real easy to try and get things lining up and working the way a cancer surgery would have gone. So I'm sure it was, and that's one of the reasons I decided to go public and do stuff, was to try and help make things better. And there was a lot of things that happened that, I'm hoping that would make things better for the next person and the next person. I know somebody brought me a pillow at one time because I could only sleep at one angle on that bed. It's like I had to get that bed just about perfect. Otherwise, I felt like I was going to choke on my own spit and blood. And the nurse said, well, we've got a pillow that kind of form fits, and it's harder than, your foamy pillows or whatever. So you can actually really form it to fit however you want. And to me, that was a lifesaver because it allowed me to get more than an hour's sleep a night. Because every time I want and felt like I needed to turn, it's like, okay, now I got to readjust, do this, do that. But, I'd form fit that pillow to go around my ear and get me at that right level. When I was ready to turn, I just flop that pillow over and lay on the other side, and I was back to sleep. So to me, that was a game changer and should be used with every surgery like that somebody, that should be standard equipment, and if somebody comes in with that kind of injury, that they should be issued one of those pills, because it was a game changer in my book.
So this is kind of just another picture showing how we planned out the reconstruction using his left fibula bone. So as you can see, there's 3 different segments. We keep those segments connected to their blood supply in the leg. And then we're able to kind of mold them in a way that it just kind of snaps on to his mandible. And the green segments are kind of the reconstructed portions. And so that's exactly what we did with Rudy. And Rudy did all the hard work, frankly, at the end of the day, and he made this as easy as possible for us. And so that was kind of our surgical plan that we were able to carry out.
One thing that who can chew and eat and talk, who can chew and eat and talk, without that, restoring that function is just very, very difficult in this kind of situation when so much bone is missing. And so these, the positions of these implants was decided along with the engineers of the company. We do this on the computer and place these things. And then a cutting and drill guide is then designed and fabricated to fit onto the fibula. And that drill guide corresponds exactly to the cuts that have to be made to make this form and to make all the parts fit. And so all the holes are pre-drilled, and the holes to guide the implants are all pre-made. And then once the fibula is harvested from the leg, that cutting and drill guide guides the cuts that need to be made. It's like wood shop where you're mortising a complicated wood piece. And then the guides are made to place those implants in an exact position. And that exact position has to be duplicated in the mouth. And then the parts, the bone plate that puts everything together is all designed by computer. And that fits all the holes that were pre-drilled. And so this fibula, conforming to that bone plate, then is screwed right into the mandible and everything fits together.
Okay, great. So, the final piece of Rudy's surgery, once we got the bone into place and the plate there, is to cover kind of his chin and lower lip. And so we used radial forearm pre-flap. This next slide. Sorry about that. Frog in my throat, but we're really trying to make a good support system for his lower lip, and to remake his oral cavity so that he can eat and drink. And I think one of the amazing kind of memories I have of Rudy is as he was recovering, it's just like every time you'd go up to see him on the floor or hear about him, he had a new story that he had told a nurse or someone. It kind of inspired. It just like brought the whole hospital to life. I think everybody was talking about it, everyone was excited about it. And it was all like the enthusiasm and spirit of Rudy just shining through the whole situation, which was really cool.
Rudy, this was a major surgery. How did you power through, and what motivated you?
Well, first I'd like to say I was a little disappointed in the beginning because I asked for titanium fangs and a titanium jaw so I could bite the bear back. But that wasn't an option. After getting home and recovering at home for a while. I had a lot of people tell me that they were inspired by my story and I was a hero and this and that and the other. It's like, I wasn't saving Cub Scouts from a bear attack and put myself between myself and them, so it wasn't like I was really a hero. But I think my attitude and my outlook during this process comes from two things. One, I've got the greatest job in the world. I love what I do. I get to take people out in the mountains of Montana, and sometimes they see animals, sometimes they don't, but they get to see the grandeur and the vastness that God created. And I don't remember, I think it was really early in the ICU that my bishop came down from Montana to give me a blessing. And in that blessing, he told me how to grow spiritually. And when he got done with the blessing, I wrote on my whiteboard so I can expect to call him when I get back home. Huh? And he's like, well, we'll see. But that night I had a dream, one of three dreams that I remember very vividly. And in that dream, I could visually see myself stepping up to that next spiritual level. The next thing I remember, I was told and shown that this was actually an answer to my prayer that I've been praying for a few years. And people were easily stunned by that. How could this be an answer to a prayer? But I know what I do for a living. It's a good job. I know it's a good thing. I bring families together to get to forget about the everyday struggles of life and they get to have fun. And I love being a highlighted individual. So I know it's a good job. So I've been praying for years that, like Christmas is going to survive. I need to make enough money that I can buy property so I'm just staying and I'm there forever. And I know me going from season to season, and some years I'll have a great season, some years I barely get by, and I don't know if I'm going to make it to the next season. So I've been praying to Heavenly Father for help. I said, I need help. I'm struggling. I need financial help. Me being Rudy, I was expecting to win the lottery or a sweepstakes, not to attack my bear. But I was shown in that dream that it would open doors and that it would bring people to me. And in the third dream, I saw a potential future for my life. But Alpine Adventures has me for 5 days a week. Sundays are devoted to doing firesides for the church anywhere they want me to go. And Monday, anywhere I go for a fireside, I'm reaching out to media and radio and podcasts in that area and sharing my story online and doing an inspirational talk wherever I can do it. So that was what was shown to me. So, if God shows you that this happened for a reason, and I believe everything happens for a reason. I believe whether it's good or bad, that it's there to teach you a lesson, to open your eyes and make you grow to be a better person. And, you can always look at your life or wherever you're at and say, well, why can't this happen to me? Why do they have a better house than me, a nicer car? Everything in your life could be better. But you can turn around and everything in your life could be worse too. You could lose your job and be one paycheck away from being that guy on the street corner asking for money to get food for the day for his family. So it could always be worse, it could always be better. The simple things in life, just drinking, just eating, just talking. Even shaving today took me 3 times longer than normal days because I got all these little nooks and crannies and spit running down my chin. I actually gave Dr. McCray a little crap. I said, you can tell a doctor put my chin in because the hair ended up inside my mouth instead of on my chin line. The guy might have thought of that. My stock in Kleenex, by the way. That's your tip of the day, financial tip of the day. Even though since I got my lip and teeth, I've used a whole lot less of these. It's more out of habit now from using them for a year and a half and having this is basically stuff in my mouth most of the time. So I go to the store like this. The clerk was like, oh, did you just get through the dentist? Well, kind of. I'm like, well, I was not. It's enough. But yeah, I'm the constant judge for stuff.
Awesome. So basically over the following months, we didn't see Rudy much, and that's because he was working. And I said, Rudy, we need to do another surgery on you. He's like, no, I'm working. I'll be back. Which is fair, and it just, I think, is a testament to how well he was doing. I think that he didn't need to see us, which is awesome. But we did end up getting him back to Salt Lake City in April of 2024, and Dr. Adams and I had to do a small surgery, and we have to kind of do this for all patients that have this type of surgery. We have to do small refinements to kind of make things as anatomically correct. Basically, the skin from the leg is not ever going to be like the inside of your mouth, and so we have to kind of recreate that as much as humanly possible. And so I kind of helped thin out the fat and the skin and the fat and get it to a better level so that we could get his teeth optimized. And then I'll let Dr. Adams talk about the details.
As Dr. McCray said, the skin that comes with the fibula is the skin over the leg, and so it's thick. And the mucosa in the mouth is thin, and they're not the same at all. And so we have to try to contour, to decrease the bulk, and to develop a surface in the mouth that can be restored with the denture. And so what we started with was kind of a big blob of tissue in the mouth that was, if you looked at it, you would think it was his tongue, but it actually was his skin flap. And we had to recontour that and then place it in a position that could then be restored. The other thing is that the implants, we put little posts into those implants that stick up through the skin. And again, the skin is not mucosa, so it behaves differently. And we've learned over the last year or so that there are some particular quirks and particular technical issues that make this better and better as we gain more experience. In Rudy's case, we had to make several alterations in the position of the implants and the angulation of the implants in order for them to be restored. Ultimately, it's turned out to be a very adequate dental base for a very solid prosthetic.
My turn. So this is how I got involved in the process. I was involved early in helping with those implants placed, but then I get the fun part at the end to help Rudy's get teeth again. We work on some speech sounds, and we work on the foundation here. You can kind of see in that x-ray all the surgical pieces that are in there, the plates and implants, and then my part, I put a titanium bar and titanium abutments that hook into those implants onto those. I hook that all together so that Rudy can then put teeth on top of that. And one of the reasons that we chose to do that with Rudy was because of the chin prosthesis. We wanted him to be able to take things apart and clean them and put them back together, so Rudy can take it all apart and put it back together. And the titanium bar gets to stay in there, but it took us a few months to get down that road. I think Rudy was kind of like, come on, let's go. But these things have to be pretty accurate, so it took a little bit of time.
Rudy, you didn't have teeth for over a year. What was it like when you finally got teeth placed in your mouth?
It still took me a while to get used to it. I can't open my mouth near as wide as I used to, so I was still working on it, but, to give you something to take back home, it's like, I think it was 2 weeks ago, I ate my first piece of pizza after a normal person. I actually picked up a piece and bit it off and chewed it up and swallowed it, so, it's like heaven.
And the last step, Paul Taylor?
Sure, my name is Paul Tanner, and I make facial prosthetics. I'm a prosthologist. I'm not a surgeon. I was involved because Dr. Tucker finished making his teeth, and that restores the speech and eating and swallowing. And he's still, without a lower lip, you actually can't make all of the sounds like the B's and the P's. And my role was to kind of step in and try and seal off his mouth as best as possible. So Rudy does still have a little bit of drooling. We're working on that seal that will allow him to drink water out of the bottle or a straw or whatever he chooses. And the prosthesis I made for him is actually made of silicone. It's imagine like a rubber band. It's about that same softness or stretchiness, except I can color in any way I wish. So it's originally made with clear silicone, and then I mix pigments in to match his skin color. There's one really unique thing about his prosthesis. He doesn't like to shave. I don't know any men that like to shave, but he had some scruff, and whenever I would make hair in the past, the hair tends to break off, and you have drool, and anyway, there's a lot to it. And so instead of kind of remaking inserting hair every few months, I actually created a technique where I can paint silicone to look like hair. So they're very, very thin strands of silicone that are painted onto the surface of the silicone prosthesis. So it's not hair, it doesn't stick out, but it just gives the illusion. I mean, that's really my job, is creating an illusion of lower lip and then providing that function of the speech and the swallowing. So all in all, it's a team effort for all of us, and it's taken a long time for him. I finished a year after his teeth were made. So it's a long recovery, and it's also really neat to where he could speak, let alone, it's really frustrating when you can't communicate with people. Is that true?
If you were here at the first press conference and you heard me say, hello, you can see how far I've come since then.
So his recovery is really remarkable, and what's amazing about him is he has such a positive attitude. He's always willing to share his story, and I think that positive attitude goes a long way into helping him recover, and then just kind of interacting with people again. It's hard, and I do. He mentions his business. I told Rudy, I hope you get a whole bunch of, keep doing these news stories, because I hope you get a ton of people coming to visit you in Montana and going on adventures with you. So, how often do you get to meet a bear attack survivor? It's pretty amazing.
I told him in the hospital when I first got there that I wanted to be the fastest bear recovery survivor ever. And I had to revise that, because if I didn't have this, I would have been out there in a week without a couple of days, I don't really know if I would have been thrown out of the salt like they could have just kept me frozen and I'd been done at home. But so I had to revise it to say the quickest mouth and throat hair attack survivor, because most of those guys don't survive. So my odds are pretty good that I'm going to be the quickest one. So maybe that's in Vegas.
Rudy, everyone talks about your positive attitude. What was the main motivator for you? Why did you choose positivity over everything else?
Well, I told you my attitude comes from my religious upbringing, my religious beliefs, and my job. It's like I love what I do. I had people ask me, at any time did you feel, especially up on the mountain, you're waiting for the helicopter, you get there for 2 hours. Was there any point that you felt like you weren't going to make it? I said, no, there wasn't any point that, I could tell at times I was getting weaker because at one point I had to pull my backpack over to me and put my head on it so I didn't have to hold my head up anymore. But, then I heard the helicopter that put me up again, and then I heard the second helicopter, and I see boots on the ground put me up again. Then they flew me to the Yellowstone Club, and I'm assuming they gave me a pretty good price, because the last thing I remember, they were cutting my hat leg off, and I was trying to reach into my pocket and get my truck keys out so they didn't get lost. I still don't know where my truck keys are, so I forgot my truck keys first. I could use the back, we have another set made, but could always use a spare. But that was the last thing I remember. I don't remember anything in Bozeman. According to the records, I was a 123-year-old woman that got attacked by a bear. And I didn't know bears could throw bears, but I know I lost weight in my chest and arms and my butt, but I don't think I lost that much that they could consider me a woman. Then they flew me to Salt Lake, and it's like I don't remember anything until I woke up in the ICU, and I don't remember a whole lot in the ICU even. So.
Rudy, any last thoughts or anything you want to say to your care teams?
I really appreciate everybody. It's like, I had a lot of nurses and aides that went above and beyond the call of duty. I had one person that cut out individual signage, which things for me, so I didn't have to, I could say I need a shower, write it down. I took care of it, and that's above and beyond the call of duty. And the one thing I can say I learned is, just like any business, you all need to communicate better. If somebody says, we need this, it needs to happen. It's not, Dr. McCray says, I need to do this, it needs to happen now, it needs to happen now. Or, this dressing needs to be done this way, it needs to be done this way. And we found out the ramifications of that when the VA sent me to assisted living facility. They go, things need to be done properly. Otherwise, it takes 6 months to step back. So I really appreciate the smiles. Those that I gave a little scare by playing dead when they came to the room and checked my vitals. I'm sorry. My daughter kept telling me, Dad, you're hooked up to 27 things. I know you're not dead, but I still got 22 on you.
I think we're going to wrap up unless anyone has anything else to say. All right, thanks everyone. If you took part in Rudy's Scare, we're going to take some pictures.